U of L's robotic network was set up to help us in offering expert, specialized care to parts of the state of Kentucky that may not necessarily have those services.
Show me how you can raise your arms up.
U of L Healthcare is committed to providing care to all of the people of the Commonwealth. The robotics network has allowed us to reach out, to be there for those patients and those hospitals if needed.
I think by having this remote presence, it enables rural communities to have access to the expert care that we can get at an academic center closer to home.
Very often, patients don't need the level of care that we offer here at U of L. They can be cared for in their community. Their family doesn't have to drive an hour and a half or 2 hours to come visit them. They can stay and be cared for by their own primary care doctor. Often what necessitates a transfer is the lack of neurological expertise.
By having the remote presence here, the patients can get that expert care here. We as physicians can have that opinion, that consultation close to home to make that immediate decision for the benefit of the patient.
Neurological disorders are by definition extremely complicated. And because of their complexity, many non-specialized physicians may not be able to sort out subtle differences. Before the robot, what I had to do was pick up the phone and rely on someone else's interpretation of what was going on with the patient, someone else's interpretation of the imaging, someone else's interpretation of the neurological examination to give another physician the go-ahead to give this clot-busting medication, IV-TPA, which is associated with more risk than open heart surgery. Yet, I'll do it over the phone, but having the robot really just brings my level of comfort that much higher, and knowing that I'm giving it to the correct patient under the correct circumstances.
I've had family members come in and they weren't happy with me because one of them, their father had a TIA. This was before Dr. Remmel put him on an aspirin, scheduled him for all the appropriate tests. They had a major stroke before all that was done. Doesn't happen anymore.
If you are there at the bedside, you can see the patient, examine the patient, make treatment decisions right there that can be carried out many times at the other hospital. I can look at the CAT scans and MRIs instead of waiting and waiting for a report to come through.
When a patient is transferred, that of course greatly increases the risk of potential complications. A patient is being transported in a critical condition, and during that transport time things may happen. And so by avoiding the transfer of a patient, we could potentially decrease the risk of complications to the patient.
We're only transferring in 50% of those patients that were consulted on when we use the robot. And the diagnoses are more accurate.
Being able to stay home is of course profound, as is the benefit of being able to come to a tertiary referral center where they can get the care they need.
It made it a lot faster for them to know what was wrong with me and know how to treat it.
Just a few seconds, there's this initial shock, and then they immediately just get into the mode of telling you about their problem. And I think it's because they see my face, they hear my voice, and besides hearing the voice, by my reactions, either smiling or acknowledging, nodding my head or whatever, it gives them that cue that you're talking to a human being.
When that robot came rolling in, it really fascinated me, I tell you. I'd never seen anything like that.
She comes right in and assesses the patient and talks to the patient directly.
She had me stick out my tongue, open my mouth real wide, and do some hand things like my finger to my nose. She assessed me there and she said it was a stroke.
And she knew which side the stroke was on.
Yes.
It's amazing that she knew right then what was going on.
I noticed that our patients are a lot more comfortable because they know who they're going to be going to when we transfer them up to Louisville. I think that ease of transfer goes over very, very well, especially for the families. Not all the family can make the hour-and-a-half trip up to Louisville, and they very much appreciate knowing that their family member is going to be cared for and who's going to take care of them.
We felt like we already knew her. Hey, we met you before.
And she remembered us.
I was expecting to be able to go through the mechanics of history, neurological exam, making a decision about the diagnosis and the treatment, the mechanics of it. But I had no idea that I would build the relationship with the patient and their family.
I really believe that this is going to be one of the biggest ways to improve care in the rural community by providing the subspecialty care closer to home and also assisting the physicians in making the appropriate diagnosis and management for these patients.
Other than stroke, neonatology and intensive care doctors are available, but any of our doctors that are in subspecialties that an outside hospital might need would be available to them.
Patients expect, even in rural communities, to get good patient care. They don't think that they should be in the rural communities and not have access to the same technology and resources that they have in the major centers. This will facilitate that.
With this technology, I feel like they're my colleague. I have credentials in their hospitals. We are partners in caring for those patients now, rather than separated by telephone lines and no video, no personal interaction. Because I think that once you have that opportunity to experience it, you really don't want to go back to the way it was with telephone consults.
It really brings me a great deal of pride to know that we're able to offer this at U of L. Very few centers in this country, in the world, have this.
This is the future, and it's here now.